what we want to do today is have Matt and I discuss some of the different orthopedic issues that the high energy shockwave can approach and actually correct.
Sure. Yeah. One of the conditions that folks come to us for help is for plantar fasciitis. Okay. And as you know, people that spend a lot of time on their feet, either they work a lot and they're on their feet all day, or they need to stand a lot. A lot of times they develop this severe pain arch of their foot, and it's very, very difficult for them to walk, in a way that's pain-free. And they try many things to try to get the pain under control and get the inflammation to resolve. And it could be a tedious process to get it to improve. One of the things that they try is steroid injections. There's physical therapy and stretching and all this stuff. And sometimes they even wear a boot that prevents the foot from contacting with the floor. And in many cases, it can help, but other cases are very resistant to heal. So shockwave treatment has been shown in research to show an improvement in up to 90% of patients with fasciitis, plantar fasciitis. And what it does is deliver energy deep into that fascia that's been damaged from inflammation and from overuse, and where there's tears, and sometimes they find like a spur there. Now, the spur doesn't necessarily mean that it's causing the problem, but if a spur is there along with plantar fasciitis, it usually means it's formed as a result of inflammation and calcium deposit. So this machine can disrupt that inflammation, push out inflammatory mediators like prostaglandins and things like that, and can also help with blood flow and help with healing. So that's one good option for plantar fasciitis. Another thing we see is in the area of the foot as well, which is Achilles tendonitis. And that can be overstretched, or it could be overused during people that do sports with a lot of jumping, like hurdlers or basketball players. It can tear, and then it can scar and cause trouble with range of motion. So using shockwave can disrupt a lot of the bit of binding that scar tissue can cause once they have injured it and it's healed, and a lot of the range of motion is compromised where there's too much scarring or binding, and shockwave can kind of disrupt that scar tissue and help range of motion become restored. Other conditions include epicondylitis. It's a medical term for either a golfer's elbow or tennis elbow, where a lateral epicondylitis or a medial epicondylitis, which is tennis elbow lateral and
golfer's elbow medial.
Golfer's elbow is medial. Mm-hmm. So there's a lot of pain along the epicondyle on either side of the arm, and we can deliver energy to that area and disrupt the inflammatory process, reset the stage for healing, improve blood flow, and get all the inflammation out of there.
Get range back.
Improve range of motion
and
pain.
Diminish pain, right?
Yeah, absolutely.
And when you talk about shockwave, everybody says shockwave just for convenience.
Mm-hmm.
You're talking about high energy shockwave?
High energy shockwave.
So
that's what this machine is.
Right, but even Justin Gatlin was saying shockwave. A lot of the athletes say shockwave, but it's easy to say. They don't understand high energy and low energy shockwave.